Hey, Dr. Lindsey here. In this video, I'm going to go through two cases and a guy that's probably a little older than me. I'm 60. I think he's probably 65. I worked on his wife and his son. And he came in from out of state. So when he came in, he looked like this. And we drew the typical Lindsey age-appropriate hairline, which is seen here. This was our plan. And we did his first case, which was, I think, around 2,800 grafts. And he stayed for a week, and we cleaned him, and here he is at a week. And then I think here he is at around 6 months. And then he came back at like a year and a month, and he looked pretty good in the front. Here he is. And we agreed to do his crown, and we always, well, almost always recommend adding a few hundred hairs to the hairline, because no matter how tightly we place them the first time, everybody needs a few more hairs of the hairline. And so we did a second case on him. He went back home. And then he sent these pictures in just over 2 years out from us starting. So I suspect he probably still has a little bit of growth to go in his crown. But going for him, he's got salt and peppery hair of the same kind of caliber that I have. It's average dude hair, and it matches his slightly lighter skin than mine. And will only look better as he and I both get grayer. He really wanted to make sure I didn't show his face, so I've cropped off maybe a little more than I need to on some of his selfies. But in summary, here's a fellow that came in, was a class 5 hair loss, in his mid-60s, otherwise healthy, who had 2 hair transplant cases by me, and looks completely unremarkable at 2 years out. We do these all the time. There's at least another 150 videos exactly like this. If we can help you, please give us a call. Thanks.